Today, we're going to dive into a really big shift in how we think about expertise. We'll start in the world of medical education, but trust me, what we uncover here applies to pretty much any profession out there. Probably yours too.
So let me just start by asking you this. What really makes a doctor great? I mean, is it just about having all the textbook knowledge memorized and having super steady hands? Or is there something, deeper that separates someone who's just competent from a true professional?
For the longest time, the answer to that question was laid out on this simple but really powerful framework. It shaped how we train professionals for decades, and it was known as the competency pyramid.
So, this is it. This is Miller's pyramid, which was first thought up way back in 1990. And for what felt like forever, this was the absolute gold standard. It was seen as the definitive blueprint for taking a student and turning them into a practicing doctor.
Think of it like you're climbing a ladder. You start at the very bottom with knows. That's just raw book smarts, the facts and figures. Then you climb up a rung to knows how, which is where you can actually apply that knowledge to figure things out. Next up is shows how. This is where you prove you can do the skills, but in a safe, simulated setting. And then you get to the top, does. This is the real deal, doing the job in a real clinic with real patients and nobody looking over your shoulder.
And for a good long while, that felt right. It seemed complete. I mean, if a doctor can do the job, what else is there, right? But over time, educators started to feel like something wasn't quite right. They started to see a gap, a crucial missing piece of the puzzle, right there at the very top.
And here it is, the big aha moment. The pyramid was absolutely fantastic at measuring what a doctor could do, but it said absolutely nothing about who that doctor is. It was great for technical competence, but it just couldn't capture things like a person's character, their values, or their professional identity.
So the whole community basically went back to the drawing board. How do you fill a gap like that? And this is where it gets really interesting, because it turned out there wasn't just one answer. Two really fascinating and kind of competing ideas came forward for what should be the new peak of the pyramid.
And this kicked off a really important debate. It wasn't just some little academic argument. It got right to the very heart of the question, what is the ultimate goal of professional training anyway?
The two big ideas that emerged basically boiled down to this. On one side, you've got is. This level is all about professional identity. Internalizing the values of the profession so deeply that you literally think, act, and feel like a physician. And on the other side, you've got trusted, which is a much more practical measure. Are you ready to be left alone on the job? Can we trust you to handle whatever weird thing comes through the door?
So let's dig into the IS level for a second. This was proposed back in 2016, and it's not just about learning new things, it's about a complete transformation. It's about that journey from just being a regular person to becoming a physician at your very core. The idea here is that your professional actions just flow naturally from who you are, not because you're just ticking a box or following a rulebook. Okay, now let's look at the other side of the coin, the trusted level, which came a few years later in 2021. This one is all about entrustment. It's really a judgment call that a supervisor makes. It asks, is this person ready to handle not just the routine stuff, but the messy, unpredictable, chaotic parts of the job and do it safely and by themselves? At its heart, it's really an assessment of risk.
Okay, so identity, trust, these are fantastic concepts, but they're also a little abstract, Which brings us to the next big logical question. How on earth do you actually measure something like identity or trust?
This was the real challenge that educators had to figure out. I mean, you can't just give someone a multiple-choice test on their character. It doesn't work that way. So they had to come up with totally new ways of looking at these deeper qualities.
For that IS level, the methods are much more qualitative and they take time. We're talking about things like portfolios that show a person's growth, reflective writing assignments, and getting feedback not just from the boss, but from colleagues and even patients. The real key here is watching someone's professional behavior over a long period of time, seeing the pattern emerge.
Now compare that with how you'd assess the trusted level. This is way more focused on specific high-stakes moments. It involves things like structured conversations about whether someone's ready, formal risk assessments, and then, at the end of the day, a supervisor making an official call about whether a trainee can work with less supervision. It's all about that one moment of granting autonomy.
So look, whether you're on Team Is or Team Trusted, it almost doesn't matter. The very introduction of a fifth level, any fifth level, represents something huge. It's a fundamental move away from just teaching people how to do tasks and toward developing a whole person.
And this quote just absolutely nails the idea.
The goal is no longer just training someone who can do medicine, but developing someone who is a physician. That is a massive, massive leap.
What this all boils down to is that we're moving beyond simple technical training. It's a recognition that what we really need are professionals who don't just act the part, but who genuinely embody the values of their role. It's about building a foundation of character that you can count on, especially when the pressure is on. And that kind of leaves us with one final thought, one that I think goes way beyond the walls of a hospital. Just take a second and think about your own work. What's the real difference between just doing your job and truly being a professional? That's the question that's right at the heart of Miller's missing level.